Hematology is the branch of medicine dedicated to the study, diagnosis, treatment, and prevention of diseases related to blood and its components. It encompasses a wide range of conditions, from benign disorders such as anemia to complex malignancies like leukemia and lymphoma. The field plays a critical role in understanding the intricate balance of blood cells, coagulation mechanisms, and the immune system, all of which are vital for maintaining health. Hematologists work closely with other specialists to provide comprehensive care, often bridging the gap between laboratory science and clinical practice. At the core of hematology lies the study of blood's cellular components, red blood cells, white blood cells, and platelets, as well as plasma, the liquid matrix that carries these cells. Red blood cells are essential for oxygen transport, while white blood cells are key players in the immune response, and platelets are crucial for clot formation. Any disruption in their function or production can lead to a variety of disorders. For instance, a deficiency in red blood cells results in anemia, which can manifest as fatigue, pallor, and shortness of breath, while an overproduction of white blood cells may indicate leukemia, a type of blood cancer. The scope of hematology also extends to the study of hemostasis and thrombosis, processes that regulate blood clotting. Disorders in these systems can lead to excessive bleeding or dangerous clot formation, such as in hemophilia or deep vein thrombosis, respectively. Advances in hematology have led to the development of life-saving therapies, including anticoagulants, clotting factor replacements, and targeted medications. Moreover, hematologists are at the forefront of transfusion medicine, ensuring the safe and effective use of blood products for patients in need. In addition to managing common blood disorders, hematology is deeply involved in the treatment of hematologic malignancies. Conditions such as leukemia, lymphoma, and multiple myeloma require a multidisciplinary approach, combining chemotherapy, immunotherapy, and sometimes stem cell transplantation. The field has witnessed remarkable progress in recent years, with the advent of precision medicine and targeted therapies revolutionizing outcomes for many patients. These advances not only improve survival rates, but also enhance the quality of life for individuals battling these challenging diseases. Research remains a cornerstone of hematology, driving innovation and expanding our understanding of blood-related conditions. From unraveling the genetic basis of inherited disorders to developing novel treatments for cancer, the contributions of hematology to modern medicine are profound. The integration of cutting-edge technologies, such as next-generation sequencing and gene editing, continues to push the boundaries of what is possible in both diagnosis and therapy. Ultimately, hematology is a dynamic and evolving field that underscores the complexity and importance of blood in human health. Its impact spans across clinical care, research, and education, making it an indispensable specialty in medicine. By addressing both common and rare disorders, hematologists play a pivotal role in improving patient outcomes and advancing medical science.